Good Saturday morning, everyone. Today on Perspectives, we take a look at COVID-19, 7 months after our local health officials rang the alarm, and now where we are at this moment as we enter the flu season. Now, over the past 10 months, the world has become a very different place. We now think of 2020 as the year of the pandemic. It has brought countries to a standstill, pushed hospitals to the brink, and then devastated the world's economy. Now, as of the beginning of this month, there are now more than 7.5 million cases of the coronavirus in the United States. More than 211,000 Americans have died from it. And now we're encountering a new threat, the flu season. Well, it's the same message every year, get your flu shot, but with the double whammy of the pandemic, health experts are now urging Americans to take their advice very seriously. Fox News correspondent Ashley Strohmeyer tells you what you need to know about this year's flu season.
Flu season is right around the corner, and with the coronavirus still a threat, health experts say it's more important now than ever to get a flu shot.
This is the time to make the public increasingly aware of the need and the value of a flu vaccine to prevent flu on top of COVID-19.
One big argument for the flu vaccine this year, hospitals don't need the added stress. As the weather gets colder, healthcare workers are anticipating a spike in COVID-19 cases. This, coupled with an onslaught of influenza patients, could overwhelm the already burnt out workforce.
This could be one of the worst seasons we've had from a public health perspective, with COVID and flu coming together.
As the U.S. braces for flu season to collide with COVID-19, some hopeful news out of the southern hemisphere. From New Zealand to South Africa to Chile, many countries reported a dramatic decrease in influenza cases during the winter. It's likely measures put in place to fight COVID-19, such as wearing a mask, social distancing, and hand washing, also limited the spread of the flu. There's no guarantee the northern hemisphere will see a similar trend, but health experts say one thing is certain: getting vaccinated is the best way to protect yourself and others from the flu.
We don't have polio today. We don't have smallpox today, and we're able to prevent severe influenza infection. Vaccinations have changed the whole scope of medical care.
The Centers for Disease Control and Prevention recommends everyone over the age of 6 months get the flu vaccine. Ashley Strohmeyer, Fox News.
That's right, to get it in October. Now, joining us today, Dr. Wendy Murphy. She's the director of the Mobile County Health Department, Bureau of Disease Surveillance and Environmental Services. And Dr. Deborah Walks, a pediatrician with the Mobile County Health Department. She practices at their Keeler Memorial Building in downtown Mobile. We talked with our two Mobile County Health Department officials about the upcoming flu season and the COVID-19 pandemic. That and more of Perspectives continues in just a moment. Joining us this morning, Dr. Wendy Murphy, the Director of Disease Surveillance for our Mobile County Health Department. We thank you for being a part of the program this morning. Good Saturday morning to you.
Thank you. Thank you, Eric.
Well, we're now 6 months into COVID-19 as relates to some of the first observations, including our first case diagnosed back in March of this year, and sadly our first death to COVID-19 also a couple of weeks later, the 27th of March of this year. Give me your observations now as we have left the summer season heading into fall. We're into fall now. Your expectations of what you thought would have happened by now, as well as where we are here in our southwest part of the state.
Yeah, it's been an interesting 6 months indeed. You know, our first case was diagnosed, or it was announced, reported to us on March 19th, and we saw a rather slow increase. Now, looking back, we didn't know this at the time, but we had a rather slow increase in cases at first. And then once the end of spring and beginning of summer got here, and at the time we didn't have the safer at home order, we didn't have mandatory mask orders, and we had an explosion of cases into late June into July. And then once the mask order was put into effect, luckily the number of cases started to come down, and we had seen over the last 5 or 6 weeks just a continual reduction in the number of cases. So that it looks like our first peak was in July, and that we are now over that peak thanks to the Safer at Home order and some of the public health recommendations and the mask mandate. We got past that. But now we're in a situation where schools are going back, sports are starting back, and this week was the first weekend, or about 5 or 6, that we actually saw an increase in the number of COVID cases reported to us. So very interesting indeed, and we're keeping a close eye on it.
Speaking of that, you talked about the peak that happened in July after the 4th of July holiday, and you all had also told us to be on alert because of the Labor Day holiday. And I was looking at the numbers, and it seemed like you had a second peak after that July 4th holiday about 6 weeks later, about August 14th. And so as we look at the Labor Day, our 6-week mark from the Labor Day holiday would be October 19th. So are you concerned, or you think that we're in a better position now to deal with what's going on as compared to back in July?
Yeah, we're definitely in a better position because the mask mandate has definitely helped with community spread transmission. Where our concern is now is with spread among young people. So what we have been seeing and what the Centers for Disease Control is reporting is that it's young people that are really driving community transmission right now. For us, we look at sort of the 18 to 24 and 25 to 49 category. What CDC is seeing nationwide is that people between the age of 20 to 29 during June, July, and August, they saw like a nearly a doubling of the number of cases in those age categories, and those age categories now during that time period accounted for about 20% of all the COVID cases. And it's challenging sometimes to message prevention measures for young, healthy people because they are more likely to have asymptomatic infection or have a very mild infection. They're going to recover with ease. But the problem is the data also shows that an increase in COVID transmission or COVID infection about 8 days after the peak in younger age groups is seen among people older than 60. So these young groups that have mild to no symptoms, that maybe don't think they're at risk of COVID, it seems that they are the ones that are driving infections in the older populations that might be more vulnerable to complications and deaths. So we continue to message to those young people, we understand you're back to school, you're back to college, you may be back to work, but it's still super important that you cover your wear a face covering, that you maintain a safe distance, that you wash your hands and disinfect surfaces, because you may unknowingly be spreading COVID to someone who has an underlying medical condition, who is immunocompromised, or is in those older categories that may have severe complications and death. So yeah, we've got to wait a couple more weeks before we find out sort of the fallout from Labor Day.
And as you talk about those age groups, I was looking at your latest breakdown, and that 25 to 49-year-old group of people, they've got over 5,000, in fact, 5,100 cases. And then, of course, that area that you talked about, the 20 to 29, they're in that group somewhat, and they have a very low amount of deaths, but the older folk, that 50 plus to 65 plus range, is just unbelievable, the numbers. So as a older adult who's 50 plus, we should maybe stay away from some of these younger folk or be mindful of our interaction and activity with them?
Yeah, definitely. Definitely. That figure that you're quoting there, that 5,176, that's a new metric that we added to our report that week. And what that calculation is that for every 1,000 people in Mobile County between the age of 18 and 24, more than 5,000 have had COVID. So that helps us sort of see where the most transmission is occurring and sort of taking out the differences in how many people we have in each of those age categories. So yes, definitely the cumulative rate of COVID illness is in that 25 to 49 that age group. So let me just go back to some early messages that we used to stick with and provide all the time, and maybe it's worth reminding people that if you are over the age of 50, if you are immunocompromised, if you're like under cancer treatment, if you have an immunocompromising chronic disease, if you have diabetes, if you're obese, if you have cardiac disease, if you have liver disease, these are the things that are going to put you at greatest risk of complication and death. So if you're in these categories, it's super important that you continue to protect yourself. So if you have a high school aged child that's back in school, or if you have college children who are maybe returning home from their campuses on the weekends, it's really important that you recognize that there is much greater transmission in those younger age groups, and you need to do what you can to protect yourselves, your household members, but also your aunts, your uncles, your grandchildren, people that you might interact with when you're home on the weekend and go to church. It's really important that you continue to physical distance and wear your mask to protect yourself.
Well, Dr. Murphy, I've got a couple of questions I want to ask you here quickly as we are getting to the end of our segment. Number one, back a few weeks ago, Montgomery County was above Mobile and Jefferson for just a moment, and then something happened, and all of a sudden both Mobile and Jefferson took off again, and Jefferson now in unbelievable numbers as it relates to cases. And then Montgomery, though, seems to have done something that we haven't been able to do yet. What has happened?
I think what happened to Montgomery happened to us in early April. I think, early in the Mobile outbreak, we had many more cases and deaths than Jefferson did at one point, because our long-term care facilities got in trouble with COVID outbreaks. And that was back during a time where we didn't have laboratory testing. We didn't recognize asymptomatic spread. Things just were in a very tenuous situation for our long-term care facilities, and we had a lot of outbreaks in nursing homes. And I think that happened in Montgomery, but happened a little bit later than maybe it happened in Mobile. But we are in such a better situation now with hospital capacity. Right now we're averaging only about 65 to 70 people in the hospitals each day with COVID-19. That has gone down dramatically, so our hospitals are in good shape. We have many fewer outbreaks in long-term care facilities now. I think maybe, only 7 or 8 that have active COVID cases. So I think all of those things, as we learn about the science, this is one big experiment for the entire globe.
Yes, it is.
And
indeed.
So as we learn more about the science and we can implement things, changes and into cohorting and quarantine and isolation and testing based on the latest science and guidance from CDC, we can really try to keep ourselves out of those very dire straits that we were in early April.
All right. Dr. Wendy Murphy, the Director of Surveillance and the Disease Surveillance of Mobile County Health Department, we thank you for joining us this morning.
Thank you, Eric.
And once again, Dr. Wendy Murphy. Also, to bring you up to date this morning, we want to bring you up to those up to date numbers there. There are now more than 300 residents of Mobile County that have died from COVID-19. And there have also been nearly 14,000 cases diagnosed in Mobile County. Now, when we return this morning, a Mobile County Health Department expert on influenza, Dr. Deborah Walks, joins us as Perspectives continues in just a moment. And our guest this morning, Dr. Deborah Walks. She is a pediatrician and also in charge of our Mobile County Health Department clinic in downtown Mobile. Thanks for joining us, Dr. Walks.
Good morning. Glad to be here.
Good morning. Glad for you to be here with us as we talk about influenza season, as well as a connection with what's going on right now with COVID-19. Now, according to most of our statistics in the nation, the flu activity peaks in December and February, but of course it can last longer and even start earlier. As you look at that, what do we normally see here in the Southwest Alabama community?
Well, the flu season usually starts around September. in our community and picks up late October. So that's why we want everyone to try to get their flu vaccine before the end of October. It does peak generally in December time frame, January, February, and then tapers off in May.
I was glad you mentioned that time frame of the flu shots, because some were saying that getting them in July and August just too early, but more so September, October, and we are right here at the interchange of these months. And so October, it definitely needs to be a time, if you are going to get that flu shot, to get the flu shot.
Exactly, yes. July, August is too early, but right now is a very good time to get your flu shot. We do have low flu activity right now, probably due to the common sense things we're doing from the COVID pandemic, like masking and social distancing, hand washing, are all helping the flu activity be low. But by the end of October, yes, it's going to pick up. When it peaks, December, January, February, if you haven't gotten your flu shot by then, it's still not too late.
When you look at what's going on with that flu shot, why is it so important to get it this year, maybe say in comparison to years past?
Right. Well, this is an unusual year. This fall, we're going to have both the COVID-19 virus and the flu virus circulating, and we know that we all know that the COVID-19 virus has sent many thousands to the hospital, and I think we're over 200,000 deaths now. So that has stressed out the healthcare system tremendously, and we don't want to run out of medical supplies. We don't want to run out of hospital beds and ICU beds. So this year in particular, it's very important, everyone 6 months of age and older, to get their flu vaccine.
Talk about that issue about the hospital beds. I understand that when the flu season peaks in December and January and February, that the hospitals go into what they call a surge mode, and so concerned about folks coming in who will be looking for beds from that perspective. And of course, as you just mentioned, the COVID-19 also causing folks to be hospitalized. So what are your concerns about that time of year with these two things overlapping?
Right. Well, just to give you a scope of the problem and the disease burden that flu can cause, about 9% of the world's population every year gets the flu. That's upward of 1 billion people. 8% of Americans get the flu every year on average. That's 27 million people get the flu. But some flu seasons are worse than others. We can't predict what a flu season is going to be like. But we had a very severe season in 2017 and 18 when 47 million cases of flu we saw, and 800,000 hospitalizations, 61,000 deaths from the flu that year. So again, yes, resources will be tight. We'll still be having COVID patients probably during the peak flu season. So to help these resources be preserved, again, there is a preventative measure, and that's the vaccine. So we want everyone to get the flu vaccine this year.
Based on what you observed the last 6 months here in our area, what are your concerns about these two things overlapping, the COVID-19 and, of course, the influenza?
Well, right. They're very similar in their symptoms: cough, fever, body ache, nausea, vomiting, chills. The COVID-19 virus can also make you lose your taste and smell. But when you come in and see the doctor or the practitioner, they're going to have, they're going to have to distinguish between the viruses, which one you have. And so there's going to have to be a lot of testing that is done. And so, it's just going to be a difficult season all the way around. So, we want people to continue to do the things that they're doing now, masking and hand washing, stay home if you're sick, to just help this particularly difficult season that we're entering.
We're getting reports from the Southern Hemisphere who experience winter, of course, the opposite of us. Both Australia and South Africa are saying that they've seen a better result to the influenza season due to us still wearing masks and social distancing and the other sanitizing things. Do you agree with that?
Absolutely. Like I said earlier, we're having low activity right now, and I'm convinced that it is due to the things that we're doing for the COVID-19 pandemic. Wearing masks definitely decreases, the spread of not only COVID but also flu. Hand washing, very important. Social distancing will help both the COVID and the flu virus. And then, of course, not exposing others when you're sick and staying home. So yes, all of those things will help. Every year, vaccine effectiveness for the flu vaccine varies, and that is due to the experts have to determine which flu viruses will be circulating in the Northern Hemisphere and put those particular strains in the vaccine. In a good matched year, the flu vaccine reduces the flu illness 40 to 60%. So we're hoping it'll be a good matched year this year.
When you look at what's going on right now with the intermixing of the two issues, COVID-19 and influenza, do you think that Dr. Bert Eichhold and Dr. Scott Harris need to impress upon the governor to maybe maintain some of the things that we're doing and putting more emphasis on it now with this being a season of two viruses of these types?
Well, that's a great question. I absolutely believe, and I think all of my leadership here at the Mobile County Health Department believe that extending the mask requirement will decrease not only COVID virus, but flu virus as well. So yes, I think that we would here at the Health Department encourage the governor and Dr. Harris to extend that mask order. Yes, sir.
And as you look at who should get the flu shot, is it for everyone to get it now, or are there some exceptions?
Well, everyone that is 6 months of age and older should try to get the flu vaccine this year. The flu affects healthy individuals. It affects those with underlying medical conditions. The people that have certain medical conditions that can put them at high risk for serious complications of the flu should particularly look into getting the flu vaccine. And those would be individuals that are pregnant, people with diabetes, heart disease, stroke, chronic lung conditions like COPD, asthma, chronic kidney disease. These individuals are much more likely of having problems when they get the flu. But the flu vaccine will definitely decrease their likelihood of severe illness, being hospitalized, or dying from the flu.
Dr. Deborah Walks, a pediatrician and, of course, in charge of our Mobile County Health Department Downtown Clinic. We thank you very much for joining us and sharing today.
Thank you for having me.
Once again, Dr. Deborah Walks, pediatrician. She practices at the Mobile County Health Department's Keeler Memorial Building in downtown Mobile. Perspectives continues after this quick break. And for more information on COVID-19, you can contact the Mobile County Health Department at mchd.org. Now, we also have a link for you on our website at fox10tv.com. We again thank both doctors for sharing with us today. Coming up next on Perspectives, are you prepared to vote in the November 3rd election? Well, Alabama voters will be electing a U.S. Senator and casting their ballots for president. Are you registered? Well, if not, hopefully you are aware that you now have less than 2 weeks to get it done. We'll give you more information on that date as well as all of the upcoming deadlines, including the absentee ballot turn-in deadline. A lot of voters are concerned about staying safe from COVID-19 and the flu, of course, so many are voting by absentee ballot. Our guests next week include a member of the Mobile County Board of Registrars, the president of the Mobile County NAACP, a nonpartisan organization, and the co-presidents of the League of Women Voters of Mobile. So join us here next Saturday morning at 8:30 for Perspectives. In the meantime, I'm Eric Reynolds. Have a great week.